I'm Paul Buss. I'm Medical Director for Aneurin Bevan Health Board. I've been given a lead role over the last few years in developing a clinical policy for do not attempt CPR for adults in Wales. In Wales, we're introducing a new All Wales do not attempt CPR policy and form from February. The form will be gradually introduced across the NHS in Wales over the next few months, and it will sit alongside existing forms, but by August it will become the only form used in Wales across all NHS sectors. Key elements of the DNACPR policy include a uniform approach for the whole NHS in Wales, one form that is recognised in all NHS sectors, and the core theme is a decision reached by sharing and involving. This important decision must be reached in a shared way with patients and should involve, whenever possible, those closest to them. The policy also has a built-in audit measure which allows for future adjustment. The new policy has communication at the heart of decision-making. It's an integral part of the process and essential for good clinical practice. The GMC number that the doctor writes on the form will activate the new DNACPR form. And also within the new policy, we've introduced a concept of a natural anticipated and accepted death. And this is a concept that may help individuals have discussions with patients and help them reach a shared decision. DNACPR is a major clinical decision. It's an important decision which cannot be understated. It's also a major personal decision for patients. The DNACPR decision, therefore, must be reached in a shared way, and it must involve those close to patients whenever possible. Hence the name of the policy, sharing and involving. DNACPR is certainly not about restricting treatment to patients. It is not about limiting any other aspect of care, but it is about finding out about patients' wishes at the end of life about CPR. It's also about providing care to patients that's informed. It's also about providing care that is tailored to the individual patient. You will find 4 elements introduced in February of this year. The main clinical policy. This contains details. It's a reference for dealing with complex cases, but also contains all the salient information required to make a proper, fully informed, shared decision with patients. This is accompanied by a quick reference guide. This contains the salient features of the policy and is useful 10-minute read to understand what the key elements of the new policy constitute. The third element is the patient information leaflet. This has been developed with patients to ensure that it delivers the key pieces of information for all of our patients to make sure that they can help with making a shared and informed decision. The fourth element is the All Wales DNACPR form. This form will be the only form available in NHS Wales for making decisions from August of this year. It will ensure clarity and consistency in relation to communication and recording of details of the discussion. Having the discussion, a senior team member needs to be nominated to have the discussion about CPR with the patient. This is a major decision for a patient and a clinician. Together, you can reach the decision in a clear knowledge of the patient's condition and having at hand evidence in relation to CPR. Time must be made available for the decision to be made and for the discussion to ensue. And it must be as private as possible in the circumstances. After the discussion has ended, you need to fill out a All Wales DNACPR form. The form is a vital record of the discussion, so it must be clearly completed. Details of how to complete the form are contained on the back of the form. The form is only active if it is signed and dated with a GMC number. Senior clinicians are also identified on the form. They have a specific role in overseeing the quality of the form and the communication that takes place, which is also recorded on the reverse of the form. Communicating the agreed position is extremely important. The policy contains details as to how the communication should take place, depending on whether the decision itself is made in a hospital or in a community setting. On the back of the form, you will see easy tick boxes to record where, as a clinician, you've decided to send copies. A vital thread through the form is the importance of respecting all patients, especially those with reduced or altered mental capacity, when having a discussion about DNACPR. Senior responsible clinicians need to understand their responsibilities in relation to the Mental Capacity Act in relation to this important decision. All local health boards have an implementation group in place. They're going to help us put the new policy into place in the forthcoming months so that it's universally implemented by August. The implementation groups will be meeting regularly across NHS Wales to update us on how the policy is proceeding, and also to help adjust the policy in line with any changes in legislation or other matters. What we must do across NHS Wales is to use this policy to have a conversation as to how we meet its central theme. We must make better decisions with patients about DNACPR by sharing information with them and involving those close to them.